The New York City skyline glitters, a breathtaking display of light and ambition that stretches as far as the eye can see. Each building tells a story of dreams, determination, and the relentless pursuit of progress. This city is more than just a collection of steel and glass. It's a symbol of American ambition, a place where fortunes are made and lost, and where the world looks for inspiration and leadership. But across the Atlantic Ocean, in the heart of Europe, another powerhouse rises. In Basel, Switzerland, Roche stands tall, its headquarters a beacon of innovation and scientific excellence. Roche is a global giant in pharmaceuticals, shaping the future of healthcare for millions around the world. Its influence stretches far beyond Swiss borders, touching lives on every continent. Now, these two worlds, one defined by American energy, the other by European precision, are colliding in a partnership that could change everything. Roche is placing a $50 billion bet on America, a move that signals not just confidence but a bold vision for the future. It's a gamble that could reshape healthcare as we know it, bringing new hope to patients and new challenges to the industry. Roche is no stranger to innovation. For decades, its scientists have pushed the boundaries of what's possible, turning groundbreaking research into real-world solutions. For over a century, Roche has been at the forefront of medicine, evolving from humble beginnings to become a leader in life-saving therapies. The company has developed treatments that have changed the course of diseases like cancer, HIV, and multiple sclerosis, offering hope where there was once despair. Now Roche is setting its sights on America's healthcare future. It's investing billions in research, manufacturing, and cutting-edge technologies, aiming to accelerate the next wave of medical breakthroughs. But this isn't just about business or profit margins. It's about forging partnerships with American hospitals, doctors, and researchers to make a real difference in people's lives. It's about pushing the boundaries of science, exploring new frontiers in genetics, diagnostics, and personalized medicine. It's about tackling some of the biggest health challenges facing our nation, like heart disease, which remains the leading cause of death in America. And it's about addressing kidney failure, obesity, and other chronic conditions that affect millions of Americans every year. Roche's investment is a bold statement, a declaration that the company believes in the power of American innovation and the promise of a healthier future. Because for Roche, the future of medicine is being written right here in America, where science, ambition, and hope come together to change the world. $50 billion. It's a number that almost defies imagination, a sum so vast it could fund entire cities, transform industries, or change the course of history. But today, it's being directed at something even more profound: the future of American healthcare. That's the staggering sum Roche is pouring into the American healthcare system. This isn't just a business transaction, it's a bold statement, a commitment to reshaping how medicine is discovered, delivered, and experienced in the United States. It's a gamble on a scale rarely seen, even in the high-stakes world of global finance. Investors are watching closely, and the industry is buzzing with speculation about what this could mean for the future. But Roche isn't known for making small moves. This is a company with a legacy of taking risks that pay off, of pushing boundaries in science and business alike. This is a company that thinks big. Their vision extends far beyond the next quarter or the next product launch. They're looking decades ahead, imagining a world where disease is detected earlier, treated more precisely, and in some cases prevented altogether. That invests for the long term. Roche is building not just for today but for generations to come, laying the groundwork for discoveries that could change lives for years, even centuries. This isn't just about building factories or labs. It's about creating the infrastructure and the environment where the brightest minds can come together to solve the toughest medical challenges. It's about creating an ecosystem of innovation. Roche is fostering a culture where collaboration, creativity, and cutting-edge technology intersect, driving progress at an unprecedented pace. Roche is partnering with leading universities, hospitals, and tech companies. By joining forces with the best minds in medicine, technology, and academia, they're accelerating the pace of discovery and bringing new treatments to patients faster than ever before. They're investing in artificial intelligence, gene editing, and personalized medicine. These are the frontiers of science, fields that promise to revolutionize how we understand, diagnose, and treat disease, making healthcare more precise and more personal. The goal is ambitious: to develop breakthrough treatments for diseases that have plagued humanity for generations. From cancer to rare genetic disorders, Roche is aiming to tackle the illnesses that have long seemed insurmountable. This investment is a vote of confidence in American ingenuity. It's a recognition of the talent, drive, and creativity that define the nation's scientific community. Roche sees the potential for the United States to lead the world in healthcare innovation. With its world-class universities, vibrant tech sector, and diverse patient population, America is uniquely positioned to shape the future of medicine. And they're putting their money where their mouth is. This isn't just a promise. It's a tangible, massive investment that will ripple through the economy, the healthcare system, and the lives of millions. This is about more than just profits. It's about responsibility, about using resources and expertise to make a real difference in the world. It's about improving the lives of millions of Americans, giving hope to families, empowering doctors, and building a healthier future for all. Roche's investment is igniting a manufacturing renaissance across America. From Massachusetts to California, new facilities are springing up, creating jobs and breathing life into local economies. In Indiana, a state-of-the-art manufacturing plant is producing life-saving cancer drugs. In Kentucky, a new facility is focused on developing cutting-edge gene therapies. And in Pennsylvania, Roche is investing in a next-generation facility for personalized medicine. This isn't just about bringing manufacturing jobs back to America. It's about creating high-skilled, high-paying jobs of the future. Jobs in biotechnology, biomanufacturing, and data science. Jobs that require specialized skills and training. Roche's investment is helping to create a workforce for the 21st century. The COVID-19 pandemic exposed the fragility of global supply chains. Countries around the world scrambled to secure essential medical supplies. Roche's investment is part of a larger trend, bringing manufacturing back home. The pandemic highlighted the risks of relying on a handful of countries for critical medicines. Roche's investment in American manufacturing is a strategic move. It reduces reliance on global supply chains and ensures a more stable supply of essential medicines for American patients. This shift towards local manufacturing is gaining momentum. Governments and corporations are recognizing the importance of having a secure and resilient healthcare infrastructure. Roche is at the forefront of this movement, leading the way in reshoring pharmaceutical manufacturing. The impact of Roche's investment goes far beyond the balance sheet. It's about creating jobs, boosting the economy, and improving the lives of Americans. Roche's expansion is creating over 12,000 jobs across the country. These are good-paying jobs in fields like research, manufacturing, and technology. Jobs that provide a pathway to the middle class. Jobs that strengthen communities. But it's not just about the numbers. It's about the people whose lives are being touched by this investment. The scientists developing groundbreaking treatments. The factory workers producing life-saving medicines. And of course, the patients who will benefit from these innovations. Roche's investment isn't just about expanding existing operations. It's about, really pushing the boundaries of medical science. They're exploring new frontiers in healthcare. One area of focus is the development of new treatments for obesity and metabolic diseases. Roche is investing heavily in research into new weight loss drugs and glucose monitoring technologies. These innovations have the potential to transform the lives of millions of Americans who are struggling with these conditions. Another area of intense research is gene therapy. Roche is developing cutting-edge treatments that target the root causes of genetic diseases. This is the future of medicine, and honestly, Roche is leading the charge. Roche's $50 billion investment is, a real shot in the arm for the American economy. It's a sign of confidence in the future of American innovation. The construction of new facilities, the hiring of thousands of workers, and the ripple effects throughout the supply chain are creating a surge of economic activity. Local businesses are benefiting from increased demand, tax revenues are rising, and communities are being revitalized. This investment is a testament to the enduring strength of the American economy. It's a reminder that the United States remains a global leader in innovation and a magnet for foreign investment. While Roche's investment holds immense promise, it's not without its critics. Some folks worry about the potential for monopolies and rising drug costs. Roche is, after all, a major player in the pharmaceutical industry. Its increased presence in the U.S. market raises concerns about reduced competition and the potential for higher drug prices. Critics argue that this could make life-saving medications unaffordable for many Americans. Another concern is the potential for healthcare inequality. Will everyone benefit equally from these innovations? Or will the benefits be concentrated among the wealthy and well-connected? These are, honestly, legitimate concerns that need to be addressed. Roche's $50 billion gamble is a defining moment for American healthcare. This is not just another business investment, it's a bold move that could reshape the entire landscape of medicine in the United States and beyond. The sheer scale of this commitment signals a new era, one where innovation and ambition collide on a global stage. It's a bet on the ingenuity of American scientists and the strength of the American economy. The stakes are high. Roche is putting its faith in the creativity, expertise, and relentless drive of researchers across the country. Their discoveries could set new standards for medical breakthroughs, not just for Americans but for people everywhere. If successful, Roche's investment could lead to groundbreaking treatments for some of the world's most challenging diseases. Imagine new therapies for cancer, rare genetic disorders, or chronic illnesses that have long eluded effective solutions. The ripple effects could transform lives, offering hope to millions who are waiting for a cure. It could create thousands of jobs and boost the American economy. From high-tech research positions to manufacturing and distribution, the impact would be felt in communities across the nation. New opportunities could emerge for young scientists, engineers, and healthcare professionals, fueling a new generation of innovation. But, there are risks. The potential for monopolies, rising drug costs, and the possibility that life-saving treatments may become unaffordable for many Americans are real concerns. As pharmaceutical giants grow, so does their influence over pricing and access. And healthcare inequality cannot be ignored. The world is watching to see if this investment will widen the gap between those who can afford care and those who cannot. Will innovation be shared, or will it deepen existing divides? These are questions that demand answers. Roche's gamble is a test case for the future of healthcare innovation. It challenges the industry to balance profit with purpose, and to ensure that progress benefits everyone, not just a privileged few. It's a reminder that the pursuit of scientific progress is not without its challenges. Setbacks, failures, and ethical dilemmas are part of the journey. But so is the determination to keep moving forward, even when the path is uncertain. In the end, the potential rewards, longer lives, healthier families, and a brighter future, are just too great to ignore. The world is holding its breath, waiting to see what happens next.